If you know someone with type 2 diabetes, please pause this video right now and click the share button. It's right under the video screen. If you have a friend or a loved one, they absolutely need this information to help reverse their type 2 diabetes or help improve their type 1 diabetes to a degree they never thought possible. The information we talk about in this video is going to help you do just that. I'm Dr. Ken Berry, a family physician with 20 years of clinical experience taking care of diabetic patients every day. And my special guest today is Dr. Tony Hampton, who's also a family physician, who's spent the majority of his career taking care of people with diabetes, with prediabetes, type 1, type 2, insulin resistance, and hyperinsulinemia. So absolutely, this is the time to share this. I'm live right now on Facebook and on YouTube. You can share this on either platform, or you can share it off of Facebook or YouTube onto Instagram, Twitter. You can send it in an email, in a WhatsApp. Sharing this video with a diabetic could literally add years to their life. Not kidding, not joking, not being facetious. Literally save their life, give them better quality of life and better quality years of life. So let's bring on Dr. Hampton and let's get this conversation started. I'm excited about this. There he is, Dr. Hampton.
Hey, what's going on, buddy?
Man, I'm doing great. It's such a pleasure to have you on. I've been following you for a while on Twitter. You've been slapping around the calorie in, calorie out people and other assorted purveyors of ignorant information, and I applaud you for that, and I respect you for that. And I'm very glad to have you as a guest today. Tell us, before we get started, just a little bit about you and why we should care what you think.
Well, I think part of it is what you just said in terms of that years of experience. I've actually been practicing for about 23 years.
Oh, you got me beat.
I got you beat, man. So it's all good, though. We all in the same family. So,
right.
So I've been doing that, and I was trained as a family doctor as well. And what I like about a family doctor is we think about the entire family, the whole person, and people should care about what I have to say for a couple of reasons. One is I kind of understand the struggle. I had some folk in my family that's been through this whole diabetes journey, and I've been able in my practice to take so many people off medicine. I'm sure you've had the same experience, that it's countless. Prior to my approach that deals with looking at the person, their lifestyle, nobody got off medicine. I literally in my career, I can count a couple of people, and they were like ultra athletes. When it comes to the average person that you may feel that you are, nobody got off medicine, because I was trained to manage disease in traditional medicine and keep people managed well. And if I managed them well, I was considered a good doctor. Then I had this light bulb moment. And what happened was I recognized, and I'm sure you have too, Doc, that if we just focus on managing people's diabetes with their blood sugar, that number, we're really just managing their symptoms. Because the real issue, and doctors know this, they just don't practice like they know it, is insulin resistance. So once I understood that the insulin is not doing a very good job, your body's making plenty of it, and you're not able to utilize it, it was a light bulb moment. It was the moment when I realized I was given Tylenol for a lung infection when I should have been given antibiotics. The antibiotic for diabetes is insulin resistance, and that's also true for obesity, because obesity is an insulin issue as well. And we can talk a little bit about that too. But so stop worrying about calories. We're not trying to insult our colleagues. We're just trying to redirect them and ask them to think outside the box. And what most doctors do, they follow guidelines that are biased and outdated, and they never question the guidelines. And what me and Dr. Berry did one day, we started questioning things. We said, this doesn't seem to make sense. And when you start to question things and then you try something different, and then you see results, then you just start running in the right direction. And we're just trying to get you guys to come with us, because I'm sick and tired of families losing family members for lack of knowledge. So yeah. I applaud anybody that's listening right now, because you're taking the time to improve your life.
Yeah, I totally agree. I don't think doctors are evil or bad people. but they are very capable of lazily, thoughtlessly following the guidelines that have been put out by the American Diabetes Association and the American Heart Association.
Right.
And if you do that, you'll spend the entirety of your practice keeping people's hemoglobin A1C between 6.5 and 7.5. You'll go play golf. You'll pay off your Mercedes. You'll put your kids through college. And in reality, you ain't really helped nobody.
Nope.
No.
And in fact, let me just say this.
Yes.
If you think about this is the conundrum. You have doctors who have heard of advanced studies, and look that up if you like, guys. Advanced study, Accord study, the VA diabetes trial. They did these studies. They controlled the diabetes to the T, primarily with insulin. And when they controlled it to the T, good news, no neuropathy, no nephropathy, no retinopathy, the eye, the kidney, and the feet. But guess what? People dying of heart attack and stroke. And guess what's the leading causes of death in our country? Heart attack and stroke. So what they found is that even when you control these things, the symptoms, you don't reverse the two leading causes of death. So, and then you figure it out. Oh, it's something called metabolic syndrome, where you look at the blood pressure.
Well, let me interrupt you right there, doctor.
Yeah.
What most doctors took away from those two huge studies,
Yes, sir.
was that, we probably shouldn't control diabetes very tightly.
Right, I know. That's
Literally,
right.
That's the message that thousands of doctors took away from those studies.
That's right.
And indeed, the American Diabetes Association took that message from that study. They didn't get the message we shouldn't control it by raising insulin, which is what that study is very aggressive in using injectable insulin and in using insulin-producing medications like insulin. And so they lowered the rates of neuropathy and other things from diabetes because they lowered the blood sugar.
That's right.
They raised the insulin to do it, which is also probably more unhealthy than having a high blood sugar. High blood sugar is going to hurt you. High insulin is going to kill you.
That's
exactly right. But a very few doctors, and one of the very first doctors I ever heard talk about it was Dr. Jason Fung.
That's right.
He got the right message. He said, so we shouldn't have high insulin either. We should have low glucose and low insulin. And the only way to do that is either with diet or with not eating at all, which is fasting his claim to fame. And I think earlier you said something about family doctors. We look at the whole family. We manage the whole patient, not just their heart or just their leg. We manage the whole patient, but we also take the entire family and the family dynamic into account. And I think for type 2 diabetics, that's hugely important because, I mean, if you're not cooking the meals, if mama's cooking or if your wife's cooking, you're going to get in trouble if you say something about the cornbread and the cream corn and the chocolate pie for dessert. You're going to get in trouble if you start complaining about the meal, because in my house I grew up in, the first complainer was the next cook. That's how it went, right? And so the family is very important, and I hope we'll talk about that more. But yeah, many doctors, me, you, and Dr. Fung included, got the right message from those studies. Oh, you don't want high insulin either. You want to have them both low. So insulin resistance and hyperinsulinemia, which are really two discrete things, but they both come from the same source, which is just eating too many total carbohydrates on a daily basis.
And grains.
And grains, that's right.
That's right.
Yeah, absolutely. Yeah, anything that breaks down into sugar ultimately is going to spike your blood sugar, and anything that spikes your blood sugar is going to spike your insulin. That's just how it is.
That's right. And I just wish that the doctors would not settle. If your patients are not getting better, why are we doing this work that we're doing? So I started to question things, and it was obvious when I wrote my book, Fix Your Diet, Fix Your Diabetes. When I did the research from that, it was clear to my brain that only thing that seems to be correlating to this heart disease is too much insulin. So now I'm just a regular guy. You're in Tennessee. I'm here in Chicago. We're just regular doctors who just questioned it. And then I said, well, if it's insulin resistance, how do you treat that? And it was clear, just like I mentioned, metabolic syndrome. It's the lifestyle that improves the metrics that deal with metabolic syndrome. It's the lifestyle. It's the diet. What else is going to lower your triglycerides? Well, you eat fat. It's the irony of that. What else is going to help your HDL? You know, you can do a little exercise for that, but for the most part, it's dietary. So, and this is the irony. The metabolic profile, which is the HDL, LDL, blood pressure, waist circumference, probably the most important, and the blood pressure. and the blood sugar. What happens is, if you think about that, why is the LDL not in that? This is so important. Why don't they measure the LDL? Because it doesn't matter.
Yeah.
Not like we thought.
On Twitter so many times for that.
Yeah.
Both the diagnosis of metabolic syndrome does not include an LDL measurement. But more importantly, if you'll go to the American Heart Association, American College of Cardiology website, they have a tool for the prediction of cardiac risk.
Yes.
And you put in all your numbers, and indeed there is a box to put your LDL in.
Yeah.
But you can make that LDL anything you want to. It does not change your percentage of risk that the calculator spits out.
That's right.
The algorithm that they use to give you your percent risk is proprietary. They won't let you know what the algorithm is, but you can go in and put in an LDL of 150, 200, 250. It does not change your risk. They don't even use LDL to calculate it, yet that's all your doctor wants to talk about in the clinic, because that's what the guidelines tell your doctor to focus on. It's not fair to the doctor, but it's also a doctor's job to be constantly thoughtful and constantly thinking and constantly learning. And many doctors don't do that.
And I wonder what they say about diabetes in those algorithms. I mean, I wonder where diabetes sits, and I'm pretty sure
it's a yes or no question.
Exactly.
And it's on the calculator, and
that's
it does
right.
make a difference.
That's
and
right.
It does make a difference.
That's right. So diabetes is an inflammatory condition that is one of the most lethal conditions you can have. But the good news is these dietary changes we suggest not only will make it better, it just makes it go away. And it's almost malpractice that we bring people into the clinic. You got 15 or 20 minutes. I have 15-minute appointments, doc. And in that 15 minutes, I probably spend half the visit talking about diet and exercise and nutrition. Yeah. And it's all about the diet. And I'm a faster. Do you fast in the morning, doc?
I fast every day. It's just part of our life now. We very often don't even think about eating until 3 or 4 o'clock. Right. I actually broke my fast today at 4 p.m.
Yeah.
So I have time to digest a little bit. My 3 pounds of ground beef with a little bit of shredded cheese on top. That's what I've had today.
That's amazing. I had ground beef. I had ground beef too.
Coffee cola.
That's amazing. Yeah, I had ground beef. It's so funny. And then I did have a smoothie, but my smoothie had avocado, and I had flaxseed milk, for Christ's sake. So what I do is but I broke my fast at 2. And the funny thing is I've never felt better. And if you think about it, I feel phenomenal now. And I could probably wait till 9 o'clock tonight to have my dinner. And my dinner today will be, I think, some baked chicken. And I have some mac and cheese cauliflower today. So it's going to be, and if you haven't had mac and cheese cauliflower, and that's what I do, going back to some, family stuff, I go to where people are. So if you're in my clinic, and I have about 90% African American, we're going to talk about the greens and the black eyed peas, but we're going to have a conversation about cornbread. We're going to talk about, and then what I say to them is the cornbread worth the amputation?
That's a great question. And that's an excellent way to put it, because when you give them a dichotomy like that,
right,
it's very clear, it's dumb to eat the cornbread at that point.
And you can eat the ribs. Yeah. How about no barbecue sauce? Can we do it without the barbecue sauce? So if you know how to cook and you know how to, smoke some ribs, they're going to be delicious. So it's no reason for us we don't have to, if you came to my house or Dr. Berry's house, you would not be lacking in a beautiful meal. You would love it. You would say, what's healthy about this? And you wouldn't believe me. And then 6 months to a year later, you're getting off your medicines and trying to come to my house. So this is, and it's really easy. I heard you on a video once, Doc, talk about how there's not a lot of meal prep. And when I made my ground beef, I just took the ground beef, put it in the pan, and I just cooked it. I flipped it, and I parsed it into, and I just brought it to work and had it for work. So this is not hard. Baking food, and there's no work here. You just have to be willing to cook at home more, keep it simple, cook maybe for a couple of days. I do cook for a couple of, my patients, they do 2 to 3 days on Sunday, and on Wednesday and Friday, they do 2 days, because I don't want this to be labor. And I ask them to have, what's your animal? Don't put flour or cornmeal on it, no barbecue sauce, and what's your non-starchy vegetables? This is not rocket science. And for 2 weeks, you really only need about 6 to 8 animals. and you only need about 12 to 14 sides. You mean to tell me you can't find 14 sides that are non-starchy that will save your life? So it's really about keeping things simple and walking with people, not demonizing them because they were not given the wrong information. All this low-fat craze that started all this nonsense was wrong information. And so our job is to kind of pick up the pieces and fight against the system a little bit so we can change things, because we really care about everybody listening.
Yeah, and that's totally true. Because here's the thing, a lot of people who are eating the chicken and dumplings and the cornbread and those delicious baked beans and those mashed potatoes to die for, they literally think that's a healthy meal.
Yeah, they do.
It's all vegetables.
That's right. Right?
And it's chicken and dumplings. How could that be bad? Yeah. And so, a huge part of this is gently, lovingly educating your family. No, actually the dumplings are made out of flour, which is wheat.
Right. It's just
like your blood sugar. But they don't understand that. And I remember having to tell people in my practice, they were like, well, what, I like sausage and eggs. That's good. But can I put gravy on it? And I'm like, babe, gravy is liquid bread.
Right.
And they'd be like, I never thought of that. You're right. It is liquid bread.
Yeah.
I'm like, you can't do that. Come on.
That's right.
But the gentle education, the loving, respectful education of that's actually a terrible meal.
I'm going to give you
a jelly donut and had some Cheetos for dessert. There's no difference.
I'm going to give you an example of gentle education. So let's go to the traditional Thanksgiving meal that I'm accustomed to. And if I do my greens, that's not starchy, my string beans, not starchy, my mac and cheese made of cauliflower, no cornbread, all the meat I want, you probably looking at 15 carbs or so, right? Now watch this. Now, if I do the potato salad, which is what I'm accustomed to growing up, that's got to be 25 or 30 carbs. If I do the dressing, that's going to be another probably 30 or 40 carbs. Cranberry sauce, go with the dressing. Add another, 15 or 20 with that. Spaghetti or mac and cheese made of pasta. And by the way, a tablespoon of flour is equivalent to half a tablespoon of sugar. So now we got another 40 going with that. Somebody's going to drink soda in the house for sure. We haven't gotten to the sweet potato pie. So if you just think about those sides, and you're going to have barbecue sauce on your ribs, right? So by the time you got one person who has 15 or 20 carbs, me and Dr. Berry, and hopefully you, and then you have the next person that's got like 150 to 250 carbs, who's going to be diabetic, who's going to be obese, who's going to have heart disease, who's going to have a stroke, who's going to have kidney failure. And it's the person who's not aware that the potato salad is not as innocent as it looks. And the spaghetti is just flour, which you really feed your babies flour if you really thought about it. Nobody would do that, but you don't think about it because you just see the end product. And so what we're trying to do is eat real food, eat some spaghetti made of zucchini instead. And if you know how to season food, and that's a real food as opposed to the flour, you change your life. And it'll help you in every other aspect of your life, because all that inflammation from that pasta dish causes other problems like cancer and other, and we can talk about all the diseases. It's a long list, and it's very frustrating.
And the funny thing is after they've had that huge carbohydrate meal, they'll get all sleepy, and they'll blame getting sleepy on the turkey or the ham.
Right.
Or the ribs. It's like, ooh, that turkey made me sleepy because it's got man, right? And it's like, no, honey, you sleepy because your blood sugar is 450 right now. That's why you're sleepy. It's got nothing to do with the turkey. Let's dive into the insulin and some of the terrible, disastrous things that it can do to the human body.
That's right. Well, insulin is wow. It's first of all, I think the first thing people need to understand is that obesity is, and I probably learned this from Dr. Fong too, but obesity is not a calorie problem. And I'm mentioning obesity because it's diabesity, right? So it's not a calorie problem. And we went through this whole calories in, calories out, the first law of thermodynamics. And the reality is where that calorie, what it does in your body will depend on the person that it enters and what the nutrient was. So the first thing you have to understand is that a calorie is not that important. So, but insulin itself, insulin is considered the fat storage hormone. So when you think about insulin, you have to ask yourself that what is its main job? Well, if you consume greater than about 60 carbs in a meal and you got about a couple of hours to digest it, what happens is anything above 60 is going to get stored as fat. And then once you get that fat storage, what happens is that causes inflammation. That causes, so it's not, and I'm not just talking about diabetes related problems. I'm talking about arthritis. So if your insulin is spiking constantly and of course you got to keep eating because you're hungry because of the spikes, it's gonna be a disaster. So the key is to understand that insulin has this incredible negative effect on your body when it's done in excess. And it's really, it's one of those things that you just have to understand that when you get insulin resistance, meaning that you cannot, you're not able to utilize the insulin the way it should be. It's almost like you keep making it, but it's just not working. It's like having a nice car and it just won't get the job done. It just wreaks havoc on your body. So I think the big goal for everybody listening is what do I need to do to prevent my body from spiking insulin? So if you go back to what the title of the podcast is going to be, and by the way, I just want to do a shout out to Dr. Dartson. She's a young lady that has a podcast called Purgatory. I went to college at Xavier with her, so I want to mention her just because she inspired me there. And then I want to thank you, Doc, for inspiring me about these YouTube videos. And I think that it's clear that I need to. So let's go back. So I want to go back to why did we get this insulin spike? There are many factors. So that nest in that, protecting your nest podcast, the nest is really about nutrition. So we're talking about low carb, high fat, avoiding grains. That's number one. Number two is fasting. If you want to reverse diabetes, the fastest way to reverse diabetes is not to eat, because then you're not requiring insulin, duh. And then another thing that you want to do is you want to, when you exercise, what happens, particularly muscle, you're going to be able to utilize that sugar easier. So your need for insulin is going to go down. If you don't get enough sleep, that's the S in the nest, then you're going to, every time they do sleep studies, University of Chicago, Wisconsin, Stanford, when you sleep for 4 or 5 hours, you become borderline diabetic within a week or two. Stress, for the same reason, your cortisol goes up, you make sugar. And then the T is for, how you think, avoiding traumas. And that's kind of like the nest. And then the R, we need a rope to climb up to the nest, right? And so if you're the R is for relationships. Imagine if you're in a toxic relationship, your sugar is going to be high. Your blood pressure is going to be high. So this is the root cause of why we have all this hyperinsulinemia. The O is exposing yourself to the wrong organisms. And certain organisms can harm us. Some will help us. Bacteroides, bacteria in our gut helps us. Then Firmicutes bacteria makes us gain weight. If you go to the south, the P is for pollutants. If you come to the south side of Chicago, Doc, you'll see a lot of folk of color on the south side living around factories. And then you're like, well, why do they have asthma? Why do they have all these chronic inflammatory? Well, because they're living around poison. And then the E in the rope is for emotions and your life experiences. So my life experience may say, I need to have cornbread. I can't eat greens without cornbread. That's harming me. And then the other E is for your emotions. If you're depressed, your sugar is going to be high. If you're depressed, you're going to, have anxiety and all these other issues. So my point of bringing that all up is that all of these factors are the root cause of why you have hyperinsulinemia. If you do really good on some of them, you do the nest part, the first part of this really well, but you don't deal with the relationship, you're still going to be sick. You're still going to have a heart attack. You're still going to have a stroke. So we have to address the root cause, and what other doctors have not done, because again, they were in the disease management model. Me and Doctor are here saying that we're in the root. What's the root cause of your problem? And in 15 minutes, what's the chance you're going to figure that out, right? And then let's focus on the root cause instead of just giving it a Band-Aid. So those are kind of like, that's how I kind of see all of this. I'm constantly trying to figure out what's the root cause. How can I guide my patient, even one visit at a time? What's that one thing we can talk about? What's that one intervention we need to make? And once we start piecing away at that, then we have a path to getting off medicine.
Yep, I 100% agree. So what about, so hypertension? Let's talk about hypertension.
Yeah, absolutely.
Part of
same disease. Same disease.
And that's exactly. And when I say that,
yeah,
especially around another healthcare provider, they look at me like I'm from Mars. What do you mean hypertension? It's a completely different disease.
Yeah.
It's idiopathic. It's essential. We don't know. I'm like, dude, no, it's all
it's the same disease.
Same disease. And that's the thing. There's this old thinking in science and philosophy called Occam's razor. And it basically says, to just kind of paraphrase it, don't blame something on multiple causes.
Right.
If you can possibly just blame it on one cause.
That's right. That's right.
And this is a case where we apply Occam's razor. If you fix the hyperinsulinemia and the insulin resistance by all the things that Dr. Hampton was just talking about, the number one thing being lowering your carbohydrate intake, but all those other things are important too.
That's right. That's number one. I agree. The end in that nest is the most important.
Yeah. You fix the root cause.
Done. Right.
Everything else either gets better or goes completely away.
That's right. That's right.
And I've had so many patients, Doc, back in the last few years of my practice, where they'd go keto, hardcore, like, oh, I love it. I saw your YouTube video. I'm doing keto. And they'd be on glucophage. They'd be on Acupril. They'd be on ACTZ. And they'd be on a little Lipitor. And I would lower their Lipitor to the lowest dose they made because they just felt like they had to have it. So I'd be like, well, you can still have it, but I'm going to lower it down to 5 milligrams. And they'd come back 2 weeks later and say, Doc, I don't know, something wrong with this keto. Every time I stand up, I pass out. I'm so lightheaded. And I said, well, what? And then I would look at their blood pressure, and it was 80/50.
Right.
That's awful, right?
That's right.
And it's like, oh, so keto's actually fixed your high blood pressure as well. We can stop one medication and lower the other. Blew them away. They're like, well, is that normal? I mean, is it possible for a diet to fix my high blood pressure? Yes, it is. If your high blood pressure is caused by hyperinsulinemia, which it is, 85% of the time.
It is. And first of all, what I like about what you just illustrated, Doc, is that I was not having conversations like that with my patients because they weren't getting better. So now, if they're not passing out, they're coming in asking me why I haven't asked them about their weight yet, because they're just upset because they haven't celebrated their weight loss or celebrated their A1C going down from 10 to 6. So, and it comes down very quickly, guys, if you're serious about this. But let's kind of go back to first of all, there's a lot of unintended consequences. So you had a guy who improved, and they're like, what's going on? I've had guys come in, and we're guys, so all the guys, shout out to all the guys. They'll come in and say, Doc, that guy downstairs working like never before.
Yep. All the time.
Amen. It happens all the time. And I'm like, you didn't have to have Viagra. And some of the ladies, their polycystic ovary situation, I've had people get off of CPAP for sleep apnea. So, but let's just talk really quickly about what I tell my patients. So if you have inflammation in your body, primarily from sugar, starch, starchy food, and grains, what happens is that inflammation affects your endothelial cells, so the cells that surround your arteries. Those endothelial cells make nitric oxide. Most of us are aware of what that is because that's what we put under our tongue when we're having chest pain. So nitric oxide causes expansion. So now you have an artery now I didn't say anything about salt. I didn't say anything about cholesterol. You have an artery that's irritated and inflamed because you're not making the nitric oxide. It will come back, by the way, so you'll know that. The other thing that's happening is that wonderful thing we call cholesterol that's supposed to be so bad. I call it the mortar for my home. It tuck points my home. So when I need my home to be safe, it's going to tuck point my home. And that's the LDL. Let's call that the so-called bad cholesterol. There's no such thing as bad cholesterol. But having said that, what happens is instead of tuck pointing my home, because there's so much inflammation, you're going to plaster. Now you got a stucco home. You thought it was a brick home. And so now you have a stiff artery because of the lack of nitric oxide, and you have an artery that has plaques in it, and you wonder where heart disease comes from. The key message that we're trying to share today is that this has nothing to do with salt. Now, if you put salt in a stiff pipe, it's going to raise your pressure, but it's not the root cause. It's like coming after the fact. The cholesterol didn't cause the inflammation. It's just trying to repair it. So this emphasis of cholesterol and salt for high blood pressure. In fact, I've heard your videos, Doc, where you say salt is actually necessary. Certainly on keto it's necessary, but you need salt. We don't need to get rid of salt. What we need to do is get rid of the things that's causing inflammation. So you need to visualize what I've just described, that the sugar and starch is what causes the artery to, and if it's stiff, that's going to raise your pressure. That's the root. So we're talking about insulin resistance. It's the same disease. And you could argue 70, 80% of the illnesses, chronic illnesses, are related to insulin resistance.
Absolutely.
So we have to really shift our focus. And there's no money being made on insulin resistance. I'm going to say this real quick. And I literally chair our health outcomes committee for our medical group, which is dealing with quality of care. So insurers have a relationship with us, and they want us to have a certain number of people on statins because they feel that that's what we should do. So I get penalized if I take a dietary approach, which don't pay well anyway. And then if I take people off medicine because I'm worried about the aches and pains, and by the way, they increase the risk for diabetes by about 68%. So if I take people off, then I actually can lose money. And
then also you're spending way too long on your office visit.
You can't do it
by diet, so you lose your productivity bonus too.
That's right. There you go. So it's really a system that we need to fix, and it's going to be one doctor at a time, one patient at a time who's frustrated, one family member at a time who are just tired of being given information that's not helping them. And if you say to a doc, this medicine's causing aches and pains, doc, I feel horrible. And their only answer is just hang in there. There's something, anything that's supposed to be beneficial to my body can't be causing all of these negative. Your body's trying to tell you something. And the key for us is to be honest about maybe we got something wrong and maybe we should listen to another perspective. And that's really what this is all about. For those who haven't heard this message before, I may be preaching to the choir for some of you guys, but for those who haven't heard this, walk away from this and say, what's wrong with some of the things I've been taught? Why are everybody, around me? Why so many family members overweight? Why so many people on medicines? And it doesn't have to be that way. We were made to be strong and to live a great life. And you can't do that when you're, stuck on medicine. So again, there's a process today. You have to heal. So those arteries we just talked about have to heal. So you don't just stop your medicines. What you do is you start the process and then you work with your doctor. And you say, hey, I'm doing this, and I need you to walk with me. And if you walk, you may not understand what I'm doing, but walk with me, and then help me because I want to be safe with this. What you don't do is be told that doesn't make sense, it's unsafe. And I think Dr. Eric Westman has a great video about cholesterol. It's called Doctors Listen Up. So I think if you go to YouTube and just type in Dr. Eric Westman, Doctors Listen Up, and it'll actually give some science to support some of the things that we're talking about.
Yep. And Dr. Westman is a good friend, and he's an excellent resource. He has tons of videos and podcast interviews on YouTube and other social media. And while you were talking, Doc, I was just thinking it's so funny. Docs like you and I and Dr. Fung and Dr. Westman are really trying to work at the root cause of chronic disease. But the average doctor is busy trying to hit all the marks that the insurance company set so that he can get his little 5% bonus.
That's right.
He's trying to hit their productivity bonus. So they're trying to see a patient every 5 minutes, get them in, get them out. And they're so confused by all the guidelines that the different societies put out that they're literally telling people to avoid the sun, avoid salt, and to avoid meat. Three things that we have been bathed in since the beginning of the human species. Next thing, they're going to be telling people to avoid water and avoid breathing.
The one thing that I have to say is that they it's almost like the ignorance that comes with lack of knowledge is they really in their heart think they're doing what's right. Because I remember when I was trying to follow guidelines, I felt bad if I didn't have enough people on statins. I felt bad if I didn't, kind of overdo it with the medications to get their blood pressure over control. So they think that they're doing the right thing because they haven't been given an alternative path. This is going to sound crazy, and you may have had the same experience. So when I wrote that Fix Your Diet, Fix Your Diabetes book, I found Dr. Jason Fong after I was done with the book, and he was talking about fasting. I'm like, what are you talking about? So I guess what I'm getting at is I learned in terms of effectivity of my practice, I have as much knowledge coming from YouTube and my colleagues that are doing this type of work than I did in medical school. And I just feel bad that in medical school, the good news is there are like the functional medicine docs, they do have a little bit of a different spin, and they do tend to look at root cause. So there are groups of doctors out there who are trained a little different. And what they believe is that we're born with certain genes. You can say, well, everybody in my family has diabetes. Well, the reality is it's those environmental factors. Everything I mentioned earlier about the nest and the rope speak to what are the environmental factors. That includes relationships, that includes emotions, that includes the pollution that are pushing my genes towards a mutation. You said we ain't gonna talk about coronavirus, but that's all about a mutation. So if you take what your genes are, and then there's a mutation, some of which start when you're in utero, if your mom's smoking or things like that, it affects your genes. What can we do to protect our genetic genome so that we are safe? And so if I get hit by some organism or some infection, my body's like, I don't like this, but I got this. And if you look at the stats, I guess I should mention this. The African-American community has been hit hard by the recent infection. And is it because they're African-American, or is it because they live on the South Side with the pollution? Or is it because they may have more chronic illnesses? And there's many factors that lead to chronic. I remember when I was visiting California, I went into a gas station and I saw organic stuff at the gas station. And if you go into a gas station where I live in Chicago, you'll see rolls of potato chips. I'm not talking about just one little section.
You mean in the gas station in Chicago, they don't have organic, hand-picked avocado?
No grass-fed, no nothing.
Same for Hornwall, Tennessee, where I grew up.
That's right.
The best thing in the gas station was beef jerky.
That's probably it. Yeah, that's right. That's right. And I never thought that I'd be like saying that's probably a much better idea than like oatmeal. Like when you tell people not to overconsume something like oatmeal, they look at you like they've been, like a deer in the lights. And so it's a big fight. But then I say, it's 38 carbs. I mean, that's before you put anything else in it. You got 38 carbs. Or certainly Raisin Bran as well. So that's the same number of carbs in soda. And if you divide it by 4, that's the teaspoons of sugar. So people just need knowledge, awareness, and those grains that we're eating now. We weren't even consuming all of that stuff in the past. I mean, we're consuming so many grains. They say, I think I've heard that it could be as much as a half a pound a day of grains. That's just a ridiculous statement. So we have to do better.
Yeah, I totally agree. And so many people, they just don't know better yet. And that applies not only to patients, but also to doctors. And so I love how you're a little more loving and
that's right.
Especially on Twitter than I am. Sometimes I get.
But you know what? I work for a large health system too, so I'm not in private practice. I got to be thoughtful.
Yeah. So I can say whatever. I might make one person mad, but everybody else still loves me. So I was like, hey, you can't make the practice mad. I understand. Yeah, but still, the way you go about it, I think people really resonate with that.
Yeah.
I'm going to help you understand, and that's good. I think that's the way it needs to be. What are just some first? So if somebody's watching this, Doc, and they're like, keto, what the hell is that?
Right.
Give us a step 1, 2, 3. What's your beginner steps? How do you just a rank beginner? They don't know anything about it.
That's right.
You're sitting in your clinic and you're trying to help them understand in 15 minutes.
That's right.
Give me your spiel.
Yeah, what I do is I remind them that most of these medical illnesses are related to starch, sugar, and grains, and so I say to them, first of all, I just ask them, what are you eating? And then I'll just get a feel for it, and I won't go into that in detail. I just say, where are you eating? Then I'll identify, and I know all these numbers in my head. Why do I know these numbers for carbs in my head? Because I use things like, I used to use that Carb Manager app. I don't really use it a lot now because I just know. Or I'll use a book like Calorie King, the Carb and Fat Counter. So in their summary, I already have a little dot phrase or a little button, and it just populates into them. So the first thing I say to them is, from this day forward, your enemy is not sugar per se on the label, it's the carbs. Ignore the sugar because it confuses you. And if you want to subtract the fiber, whatever. But my goal is to say, if you want to reverse disease, you want to look at the carbohydrates. There's only 3 macronutrients: carbohydrates, fat, and protein. And your favorite one's going to be fat. And I say that twice. Fat is your friend, and fat doesn't make you fat. And then I'll talk about the carbs. And then what I say to them is, your goal is to look at where you are now. And I need you to you got to get that number. So the first thing is just to make it simple. That's number 1. Number 2 is I talk about water. I say, if you're hungry, you put a sticker on your refrigerator. You're going to drink water whenever you're hungry, because most of the times you're not hungry, you're thirsty. So I get them in a habit when and I do encourage them to fast. I say, what I do is I say maybe between 10 and 6 or 11 and 7 or 12 and 8, let's not eat breakfast. Some people have already done it. They just don't do it consistently. And they feel bad when they don't do it because they didn't realize that the Kellogg and Quaker people came up with this breakfast is the most important meal lie, and it's a lie. And then what I say to them, I actually encourage them to consider when they have their first meal, if you like eggs, how about boil some eggs on Sunday? That'll get you through. It's like Easter, right? So enough eggs, you cover them, put them in your refrigerator at work, grab 2 or 3 eggs, grab some nuts and seeds, maybe some guacamole, maybe some beef. What I do is I give them an idea of what to eat. And then for dinner, we go back to what I said earlier. I say, what's your 6 animals for 2 weeks? What's your 12 sides? I give them a sheet and say, first of all, most vegetables are not starchy, so that's easy. But I'll give them a sheet and say, of these 30 or 40 vegetables, I need you to find 12. Of these, meat's meat. And you don't have to be like, we don't even, to be honest with you, Doc, do I try to do grass-fed and all that stuff? Sure. But is it really that serious? I don't think we really even know. So I'm not suggesting that you don't do those things. Maybe it's a cleaner source. Maybe it's less inflammatory. What I'm trying to say is, what's more important is to not eat the pasta and the potatoes and the rice and the bread. And then I introduce them to things like cauliflower rice and mashed cauliflower and cauliflower tots and things like that, which taste fine. And what I do is I try to keep it real simple. I always do that little nest thing because I tell them exercise is the least important, but if you move your body, there's benefit. And then I do the sleep hygiene. We talk about that. We talk about the stress, and then I asked them to listen to some inspirational. So that T for how you think, I need you to listen to some inspirational. Part of why I'm going to get my Dr. Tony Hampton website going, which will be up in a couple of weeks, a little bit after mid-June, is to have a place where people can go, just like with you, Doc, make information easily accessible and use it really more to coach people. Like literally people need to be coached along. So part of the biggest thing I do as a physician is I'm like Dicka, I'm like a coach, and I'm just like trying to hold their hand. They're on training wheels. They're kind of wobbling, and I'm like, I got you. And then I let them go, and then I let them wobble. And before you look up, they're riding their own bike. So I have a very simple approach. Eat those 2 main meals. I kind of let them know what the snacks are, give them a little handout, and I'll have that stuff on my website. And what I want people to understand is that don't make this hard. You already eat chicken, fish, turkey, all of this stuff. You're just not going to put all that garbage on it. You already eat non-starchy vegetables. Maybe you didn't know that you can eat your broccoli with a little, the right kind of oils on it. I always say boca, butter, olive oil, coconut oil, avocado oil. Obviously the coconut and avocado for the higher temperatures, but I give them permission to use those types of things. But again, there's nothing wrong with the animals. The animals, for years, we've been eating animals. We've been fasting for, forever. So to suggest that those things are harmful is a ridiculous thing. And then the idea that they have to be low fat is also ridiculous, because why would they be made with fat if we're not supposed to eat it doesn't really make sense. So I don't want to be overly simplistic. I'm just saying, think about how ridiculous that sounds. So I agree. Yeah,
100% agree. I think, and so I have a 3 I have 3 filters that I put everything through before I talk about it on a video. It's got to make paleoanthropological sense.
Right.
Number one, what did we do 100,000 years ago? And we have ways of knowing what we ate yesterday in a corpse, or 100,000 years ago. We can do the stable isotope analysis, and we could tell they ate as much fatty meat as they could get their hands on if there was fatty meat to have.
That's right.
And so to say now, oh, don't eat the fatty meat, is just it's an extraordinary claim, and you don't have any evidence to back that up. So you just need to shut up, because that doesn't make no sense. If you're gonna, and it'd be just like if a doctor said, well, you got to stop drinking water. It's bad for you. That doctor better have some good research for that. So you're going to tell me to stay out of the sun. You don't have no good research. You're going to tell me to avoid salt. You don't have no good research. And you're going to tell me to not eat fatty meat that my species has eaten for 250,000 years, and you don't have no good evidence. But yet I'm supposed to trust you.
That's right. And by the way, I mentioned earlier that if you come to our house, you would be disappointed. Well, if I could put salt, and just understand that carbohydrates, think about that, hydrate attracts water and salt and magnesium, potassium, and you hold on to fluid when you eat a lot of starchy food. Well, guess what? Keto is the opposite, or low carb. It gets rid of salt and water and magnesium. So that's why you have to replace it. Some people who start off with this get keto flu, and then they have to replace the potassium. I actually use cream of tartar because that has potassium. I use pink salt that has sodium, a little magnesium. But my point is, you actually have to add salt and fat to your food. So please tell me that you don't think that'll taste good. It will. In fact, I have a unrelated thing. So when you're trying to ask yourself, what about desserts, Doc? And isn't desserts stressed backwards? Didn't you hear that before? So it's just a weird thing. You should try that when you write it down. But the point is, I actually have one more piece of a chocolate. I got this from the Diet Doctors, which is another great resource. And they have a dark chocolate cake recipe, and they use eggs, dark chocolate, a vanilla flavor, and what's the other ingredient? It's just one other ingredient. But the key is that they don't use sugar and don't use flour. And it just, your brain is like, well, how is that possible? You should try it. So I would actually, so one thing about me and Doc is that there's so many resources out there. We want you to know about all of them, because they have helped to educate us. They have allowed our patients to have more resources as we try to build up resources as well. And there's really enough love and everything for everybody. There's just so much knowledge, but unfortunately, there's not enough of the conventional docs that are aware. Now, I will say this, when I got into my obesity board certification, which is not required, but it helped me to know that there were like-minded people. And that's why in this moment, I want to show some love to Dr. Because I felt like Twitter was like my homecoming. I literally felt like I was on an island by myself, right? Yep. And then I found some like-minded people on Twitter who understand this science from a non-biased perspective. And it was like a homecoming. So I want to, first of all, thank you for even inviting me to come on today. But more importantly, you are kind of, we're mentoring each other and we're helping each other. And I just want to do the same thing for those listening, and obviously for the community I serve. And we just want to touch as many lives as possible. This is all about helping people. And I'm just like humbled that I woke up one day, and if I had not waken up, if a family member hadn't gotten sick with diabetes, I probably would still be doing the same thing and thinking I'm a great doctor and thinking that's the best I can do. Yep. They take so many people off meds in my practice that the organization even started noticing. So, and the doctors actually refer people who have the same license I have, but yet they're referring people to me as if I'm some type of diabetes specialist. I'm just a family doctor who is giving people a different way of approaching their illnesses, and that's simply from the root cause. So.
Absolutely. Doc, this has been amazing. You're going to help so many diabetics either improve their type 1 or completely reverse their type 2. Tell us one more time, where can people find you? The name of that book, and I hear you have a podcast coming out. Tell us a little bit about that.
The podcast is exciting because I need to have, and obviously I'm going to invite my colleague here to be on the podcast as well. But the podcast is going to be called, Protecting Your Nest with Dr. Hampton. And what that'll do again, as we'll have guests that'll come on and talk about different aspects of the nest. And of course, we're going to need a rope to get to the nest. So we'll talk about those. So we may have somebody talk about relationships one day. We may have somebody talk about exercise. And of course, doctors like me and Dr. Berry will be talking about diet primarily. But I just want to, so that's number one. Number two is obviously we have some robust conversations on Twitter. And although I may be a little nicer and easier on people, I certainly push back whenever I need to. And of course, I'm on Facebook and Instagram and LinkedIn and things like that. But the main resource I think you should go to, and that'll be up in about about probably June 15th. I'm working on my website. I changed it to reflect this nest concept. That's drtonyhampton.com. But spell out the doctor as DOCTOR, Tony, TONY, Hampton, HAMPTON.com. That should be available. And there you'll see the videos that were inspired by the doctor. And you'll see the podcast and the other resources like the handouts that I give my patients. You are my patients too, so you'll have access to that information as well.
Beautiful, beautiful. Thank you so much, Dr. Tony Hampton. It's been an absolute pleasure. I feel like you and I could probably eat some ribs and talk for a bunch of hours before one of us run out of stuff to say.
That's right. I was going to meet you. Remember, I was going to meet you at a conference, but this epidemic thing messed up. So we're going to make sure the next conference we'll hook up. We'll break bread together for sure.
Yeah, absolutely. We can break it, but I ain't going to eat it. I will eat your ribs when you ain't looking. I'll tell you that right now. So thank you very much for joining us. You guys go follow Dr. Tony Hampton. Check out his book. Make sure and check out that podcast. And if you like this guy, tell me in the comments if you want me to have him back on for round 2. And I'll absolutely do it. Dr. Hampton, thank you so much for your time. It's been a pleasure.
Love. I appreciate you.
Yep. Thanks, guys. See you next time.